Greetings everyone to the comprehensive training. Today we are going to be talking about monitoring and evaluation for programs and interventions. My name is Shibani Kulkarni. I'm a health scientist on the Demand for Immunization team, and this presentation is also prepared by Nessa Ryan, who's a social epidemiologist on our team here at the CDC, and we are very happy to be talking about this topic today. So I'm sure a lot of you have worked or done things with monitoring and evaluation in your work. And so today we'll be talking about a little bit more in terms of concepts related to monitoring and evaluation processes throughout the life cycle of a project, how you would want to plan monitoring and evaluation, and then some measurement and dissemination about M&E and related findings. So as for the learning objectives, by the end of this session, you would have a basic understanding of monitoring and evaluation. You'll be familiar with the life cycle of an program evaluation. You'll be aware of the concepts to develop a logic model for your program, and then also choose appropriate methods to get data for your monitoring and evaluation. And overall, really the takeaway is to sort of understand the importance of having a strong M&E framework for your program as you're getting started. So let's start with some basics, just the definitions of M&E. These are two very distinct components which are required for any kind of programming or intervention. The first one is monitoring, which is more of an ongoing system for data collecting and reporting on your program activities, your products, or your outcomes. And it really sort of focuses on resource utilization and sort of accountability of what you're doing throughout your program. The other aspect is really the evaluation. This is where you do a systematic inquiry on how effective your specific program or intervention has been for a specific outcome that you're looking for. And through evaluation, what typically we would want to do is identify opportunities so that we can adjust our intervention or our program to make sure that it's the most effective. It can also inform how the program can be scaled up. And throughout your evaluation process, you will also be able to understand why your intervention was a success. And also, if your intervention wasn't a success, it can really give you insights into what could have been done better to improve your intervention. Evaluation can also help document the impact of your intervention and also the cost effectiveness. And ultimately, once you evaluate your program, you'll be able to share those findings with your stakeholders. So evaluation broadly falls under two sort of categories. One is the formative evaluation, which really focuses on pre-implementation. So what the type of evaluation you would need to do before you actually implement your program, and then also a little bit on the processes of your implementation. And then there is the summative evaluation, which focuses more on the effect of your program and the outcome it has had. So we look at it a little bit more closely in the following slides. The first phase is the formative phase or the formative evaluation, and this starts before the implementation of an intervention. And you really want to make sure that you do that so that you can get an understanding of why a particular intervention or a program is needed. You would want to find out, for example, if you are dealing with vaccine uptake issues, you would want to find out why you want to focus on a particular area. What are the main issues which are causing demand issues or any kind of uptake issues. And then that sort of helps you guide what is the best intervention that's suited to develop to achieve your outcome, to achieve your objective. And it also can give you insights into what are some of the key stakeholders you might want to include in your program planning and your evaluation, and what activities might be best suited. Overall, with formative evaluation, what it really helps you do is also understand whether your whether your intervention is going to be feasible to the context, whether it's culturally appropriate to the context. And this can lay out a very solid foundation for a successful program or an intervention. The second part is process evaluation. So as you're implementing your program, it is important to understand how your intervention is functioning. What are some of the key processes that are going on as the intervention is being implemented? What's really happening on the ground? So there are two ways to sort of look at it. One is just the quantity of activities or just a checklist of yes, no, in terms of whether the activities that you planned were implemented on time and as agreed. So just a simple sort of checklist to say, yes, these are the activities which needed to be done and they're done. The other part really gets more at the quality of the implementation. And here we are really looking for, how well certain things were implemented. So say, for example, if your activities include community engagement, how well was the community engagement implemented? Did they discuss all the topics that you had planned for discussing? Did that happen? Were the community leaders able to engage effectively with the target population? So looking at some of those aspects to really get more of the quality of the intervention is also important, because that can affect your final outcome. And process evaluation then can also sort of help you identify factors which can lead to a successful implementation of your program, or factors that were possible barriers for your program. And so evaluation findings are sort of important to account for everything as you're presenting your final results. It helps you understand implementation fidelity, so the extent to which the intervention that you delivered was really what you intended. And then it really sort of helps you not just understand that, but as you're going through the process, it can also help you inform what is some corrective action which needs to be taken to sort of fix if there are any issues, and then move ahead. The next part is outcome evaluation. So this is where you are really sort of assessing the effect of your program on a specific outcome. So evaluate sort of whether any change occurred. So for example, if you have something related to vaccines and vaccine uptake, it could be something like whether there was an increase in knowledge and people knowing about facts versus myths. Were people able to identify misinformation correctly? Were people able to sort of trust vaccines better than what they used to before your program started? Any kind of outcome or even impact evaluation for any kind of effectiveness evaluation, you would need some sort of a baseline guidance. So you would need some sort of a baseline of what was going on in the group, and then sort of look at it post your survey, post your intervention implementation, to see whether it worked or not. Evaluation design in itself is a very big field. For the purposes of this lecture, we'll not be going over evaluation design, but this slide deck also includes a number of extra slides, and I would encourage you to go and sort of review those slides, and it has some information on evaluation design as well. And then just to keep in mind that outcome and impact are sort of like these two distinct categories of sort of effectiveness measures. Outcome is something that's more immediate, so your program can sort of lead to certain outcomes, and you'll be able to find that information much sooner than an impact, which is much broader and on a larger scale, and we'll talk about that in our next slide. So impact evaluation is the last sort of stage of the evaluation process, where we're really trying to see, did your program broadly bring about the change that was desired? So did it increase vaccination coverage, or did it help to reduce vaccine preventable diseases? And so it can take several years. It can be hard to measure sometimes based on the data that you have and the resources that you're working with. It can also be influenced by several other factors, including some contextual factors which might affect the way your intervention is implemented. And so keeping that in mind, that impact evaluation can take a longer time, more resources, and it can be more intensive. So right now we just sort of went through the process, different processes, the sort of the life cycle of monitoring and evaluation. The next part is really more from a programmatic perspective, is you're planning to implement something. How are you going to plan for monitoring and evaluation? And the answer usually always is logic models. And I'm sure that in your work so far, you've had experience with developing logic models. And so what we're going to do in the next few slides is just go through the basic components to see how you can build a logic model. So logic model essentially is a graphic depiction. It's sort of a roadmap that conveys the entire rationale for whatever intervention it is that you have planned. There is sort of this relationship that's built in, for the resources that you have, what are the activities you would want to carry out, what are the outputs that you expect out of that, and how are those outputs then going to sort of influence the outcomes you are intending to measure. So that is what it sort of depicts. If it's like the way it states here in this definition, in terms of there is an implicit if-then relationship. So if A happens, it leads to B, then that leads to C. So looking at it from a very logical perspective and having those relationships is essentially what a logic model is. And so here are the components of a logic model. I'm sure this is also quite familiar to many of you. We will go over this a little bit. So the logic models sort of start with inputs, and those are essentially your resources that you need to implement your activities, and then you sort of go on to the actual activities. So what it is that the program and the staff need to do with the resources that they have, and then that leads to outputs, which are really the tangible products, whether trainings or anything of that sort or any other deliverables that results from these activities. And then those outputs sort of lead to short-term outcomes. So the changes that might occur in sort of your target group, and then that sort of leads to more intermediate outcomes or long-term outcomes or more like impacts, which really sort of helps to bring about more of the distal change. And underlying all of this are the moderators. So these are essentially the contextual factors that can either help your program or that can hinder your program, depending on whatever the context is. So let's take a look at an example. So here is a scenario for a hoax-busting chatbot for COVID-19 misinformation, for sort of preventing COVID-19 misinformation, and that is one of your intervention strategies. And so you set up this chatbot within the Ministry of Health that can help answer questions on vaccine safety and effectiveness. It can sort of demystify some of the rumors going around, so really the facts versus myths, and then inform where you can get vaccinated. That is what one of your intervention strategies. So let's look through what that sort of logic model would look like. And I'm just showing you an example. So it's just one component of the activity. And so let's see. So you have your inputs. So the inputs might look like any sort of financial or technological resources you would need to set up a chatbot. The activities will then include personnel sort of working on setting up the chatbot, technical staff sort of working on coding or AI setup and such. And then that will lead then to having the output of actually having a functional chatbot that is on the website and ready for use by the public. The outcome you would hope is that once people start using the chatbot, that they're more aware about facts versus myths, because this is more about sort of countering the rumors. And then that can lead to, if people have enough exposure, are using it regularly, then that can sort of help change their attitudes. It can increase their knowledge about consuming the right kind of information. And a long-term sustained change would be then the reduction, like the sustained reduction in the spread of misinformation. This is where long-term consequences or impact is where there are a lot of other confounding factors. So as I noted before, underlying all of these are different moderating factors. So here you'll see social and political factors which can prevent chatbot from functioning. So say whether there's a natural disaster as you roll out this program, or if that causes technological interruptions, if funding becomes an issue, or if there are any other political issues in the field that might affect how you sort of work with your intervention. So this is how you would generally think about setting up a logic model, having clear-cut relationships, and having very sort of logical ways in which you move from one step to the other is important. The one thing that is also important about a logic model is not one person can do it. It doesn't happen in one sitting. It's not always 100% correct. The best way to sort of really come up with a good logic model is when you are with your team sitting together and really trying to develop it and really trying to get everyone's perspective and understanding on how you want to flow through your program. So it's never going to be 100% right, but I think it's important to lay out what you're planning, and then you can always course correct and have that iterative process to sort of improve the flow of activities for your program. The other part that's really important in planning for M&E is stakeholder engagement. So stakeholder engagement is essentially all the relevant people that you would want for your program, and how well they are engaged in the program planning, implementation, and evaluation. So that the stakeholders can be decision makers who are actually deciding on policies and programs and other things. They can be program sponsors, so your funders, whoever is funding you, program staff, related partner organizations. You might be working with other organizations in the field, and of course your target population, your participants, whoever is it that you are actually planning this intervention for. And it's important to engage stakeholders, especially early on, is because they bring those diverse perspectives on what are going to be the key factors to consider, what are the practical issues and challenges that you need to sort of be aware of as you implement and evaluate your program. And having that stakeholder engagement early can also help with ownership and sustainability of intervention. So people are more likely to own up if they are more involved in the process, and that can help with sustainability. So how best to do the stakeholder engagement? You want to identify stakeholders early in your program. Each stakeholder should have a very clear role on how they'll be contributing to the program, to the evaluation, and then also have clear expectations on what is expected from you as a program implementer, to them. And it is important to have regular communication and updates throughout the life cycle of the program. That goes a long way in making sure that your program can run smoothly. Switching gears a little bit, so the other part of planning is actually getting the data for your evaluation. That's where measurement sort of comes in. So as you develop your logic model, you're thinking about, what are the indicators that I need to have? So that is the type of intervention you want, type of data you want to use to collect that information and see how well your program is running. And then the other sort of concept related to measurement for M&E is actually the target. So that's your outcome, to see whether you achieve the change that you're wanting to achieve and by how much. So that is the target you're looking at. So there are two concepts, the indicator and then the target. There are different types of indicators. Based in your logic model, you will see an input, output, outcome indicators and such. And so they are necessary for you to sort of have that accountability as you're planning and evaluating your program. So input indicators are more for sort of measuring the necessary program activities in terms of funding, human resources, infrastructure, technology. Process indicators can again sort of help to measure how well activities are going and what are the outputs that are coming out of your program. And then outcome indicators are going to help you see if you achieve your desired change. What the key sort of developing any kind of indicators is that they should be SMART. You may have seen this before, and the acronym stands for specific, measurable, achievable, relevant, and time-bound. So they should be specific to the things that you're planning to measure. They should be measurable in terms of you should be able to get the data that you really need to see how that indicator is working. They should be achievable. It shouldn't be something that cannot be, it should be realistic in what your program can actually achieve. They should be relevant to your program and to your activities. You cannot have a disconnect between what your activity is and then what your indicator is showing. And they should be time bound. So they should really fall within the realm of whatever your program timeline is. There is an additional slide on this as well in the extra slides, and I'd encourage you to look at that as well. So once you have your indicators and such, the other important thing is to get the data. And it is important to get good quality data and timely data so that your M&E can be planned effectively. Based on whatever your outcomes are and the objectives that you have for your evaluation, you can choose different methods. Qualitative methods are where you would use in-depth interviews, focus group discussions, any kind of narrative-based approaches. And this can really sort of help you understand how a program was received, why things worked, why things did not work. And then quantitative methods can sort of help you understand the magnitude of change or magnitude of the problem and sort of quantify the change. And you can use several sort of like surveys or questionnaires and tests and such for that. Social listening data is also very important, especially when it comes to monitoring. For several different vaccine activities, social listening data can help understand sentiments around specific issues and can sort of provide that ongoing insights, which can help you also with your program strategy. And then, like I mentioned, process data can also be, it doesn't have to be a specific way to collect data, but even ongoing regular discussions with your stakeholders and your partners can sort of help you understand, what are the key issues and how you can implement them. The other part is the integrated analysis. With multiple data sources, it is sort of important to sort of see how the different sources of data fit together and what information are they providing. Usually with multiple data sources for M&E, you will have very rich contextual information, very sort of nuanced information. So it is important to understand that information. So you always want to triangulate the findings from different data sources. So see, what are you seeing from your survey that you carried out versus what are the things that you're seeing from the key informant interviews that you conducted with healthcare workers, and then see where those findings converge, where those findings diverge, and if they converge, it sort of really helps to reinforce certain sort of aspects, and then if they diverge, it also helps you sort of step back and think, why am I seeing something different? What may be some of the reasons why I'm seeing these different findings in qualitative versus quantitative, or maybe there's a mismatch between what people are reporting in their surveys, but online the sentiment is completely different. So it really helps you sort of triangulate and understand what the issues are around the different sources of data, and how you sort of make sense of that and synthesize that. And lastly, it's sort of important to report on all sort of unique and convergent findings, so you get a very comprehensive picture of your program and how it worked and its effectiveness. And you want to lastly synthesize them in a very cohesive manner so you can highlight the key takeaways for your different stakeholders. So I'm just going to go over very briefly an example from the field, and this study essentially gives you a very comprehensive description of a program that was conducted in Nigeria to increase vaccine uptake. And this was done through community engagement, through traditional and religious leaders. There is the link right there. I would really highly encourage you to go and sort of see it. I won't run through this slide, but as I mentioned, the intervention is about engaging with traditional and religious leaders to positively sort of influence vaccine uptake. So if you so if you start with sort of like the planning aspect of it, then here they sort of have presented their theory of change. You can see the inputs, outputs, outcomes, and impact. I'll just go over one of them. So here you have the training for the traditional and religious leaders, and the intention is that this training will then lead to the training sessions that they want to cover with all of them, and that training can then help enhance leadership, knowledge, communication, gatekeeping. So those are like the immediate outcomes that are coming out of the training. It can help to improve knowledge and attitudes, and then together that can sort of create an impact on vaccine uptake and dropout rates and timeliness. So I think the key takeaway here really is to sort of look at how those relationships are established, and how they are making sure that each component of their intervention, whether it be training or community engagement or any other aspect, is sort of leading to specific outputs and outcomes. They also document their monitoring system, so they gave an overview of what that monitoring system looked like in the forms of various reports and meeting agendas and community meetings. So that really helped to understand how well the intervention was going. They also reported on issues with implementation fidelity, and so some of the contextual factors, they ran into a conspiracy theory that was going on around in that community at that time, and that affected the way their intervention was implemented. They also identified sort of these weak links in the intervention in terms of where there were issues, where engagement might not have been as good as it should have been, or what are some staffing issues and such. So really thinking through all aspects of implementation and then evaluation is sort of like the key here that I wanted to highlight. So that brings us, and like I said, I would really encourage you to go and take a look at that study. It's done very well. It really helps you to understand what key areas you should be focusing on. But based on that, just this sort of like a segue into what are some potential barriers to M&E. So based on the resources that you have, it can really affect how much evaluation you can do. So lack of skills and resources can be an issue. There may not be good data that you would want, but you may not be able to get good data. There might be concerns about negative evaluation results. So what if your program did not achieve what it was supposed to achieve for whatever reasons? And that can be a barrier to sort of really sort of effectively evaluating your program. There can be limited funding or other contextual factors which can sort of help to, can be some of the other barriers for M&E. But having said that, there are some best practices that you can always consider as you're thinking about M&E. One thing is about that I've sort of discussed in several different slides is evaluation is an iterative process. So what you're thinking about is continually how you would want to improve as you're implementing your project or your program. It's important also to start somewhere small. You may not have a big budget. You may not have the strongest sort of like technical staff that you might want, but it's important to start somewhere small, somewhere that is manageable, that you can still undertake within the resources that you have, because that helps with not only understanding the effect of your program, but also for accountability of what you're doing. And making sure that M&E starts at the very beginning. It doesn't start after your program has ended and you're trying to see how well the program worked. It has to start from the very beginning. As you plan for your program, there has to be an M&E plan that goes along with it. There are also 3 truths from the field. Evaluation sort of needs to always be tailored. I think we've sort of covered that as well. Evaluation should involve stakeholders from the very beginning, as mentioned before. And data should inform evaluation. So it should be as rigorous as possible. You should have data for the different things that you're putting out there, for the different conclusions that you're coming to from your program. It should be all data informed. And lastly, once you've done all of your monitoring and evaluation, and you're at the end of your program, and you want to disseminate your findings, it is important to disseminate your findings. So information that is obtained from the evaluation should be made available to all stakeholders. It should be also tailored. You cannot have the same report go out to your funders. It cannot be the same thing that goes out to a local partner organization or your target population. So it has to be disseminated in a way that's most effective, that conveys exactly what you would want to convey to your specific stakeholders. Lastly, this is the last slide, just some of the things that we would sort of want you to understand is that having a strong M&E framework is important. There are different resources that everyone works with in terms of funding, in terms of human resources. It really depends on where you are in terms of what kind of health system you're working with. So within the context, within whatever context that you have, whether you are working with a very lean budget and a very lean staff, within any kind of a limited context, you may not be able to do a full-scale evaluation, but it is still sort of important that you have regular monitoring and some sort of a process evaluation component to really understand how well things were implemented and to ensure accountability. If you have somewhat, somewhere in between, your resources are somewhere in between, try collecting some sort of pre and post data to really see what kind of an effect your program had. The pre-data can be some of your pre-existing data that you're aware of and sort of try to make the most of that. If you have a fabulous budget, lots of resources, lots of time, consider having a very robust evaluation design where you can compare between groups, compare at different time points, and that will sort of really give you a good sense of how well the intervention has worked. And granted, that goes mostly towards the research lane, where you're doing that and may not always be programmatically feasible. But what we are wanting to try that you take away from this is that you should be having some sort of an M&E component as you're doing any kind of a program. Also, it is important for you to look at all the social and contextual factors as you interpret what it is that your program achieved. And it is important really to make sure that all the evaluation that you are doing is ethical and is focused on equity. So making sure that your results really benefit those who are most in need. It cannot be emphasized enough that it has to be ethical and equity focused. There's a whole big area of work that is just focused on equity-based M&E, and there's lots more there as well. So having that equity lens is also very important. And so that's all we have for you today. I hope you've been able to take away some of the concepts related to M&E, really understand the importance of M&E in your program planning and implementation. We have several resources here for you to look at, which can give you more in-depth information in terms of M&E and really applying it in a more program setting as well. There are several extra slides for you to look at that go into evaluation design, different sort of components, a more in-depth sort of content on different components of evaluation. So I'll stop there, and thank you so much for your attention.